conversation because healthcare actually is one of our core principles that connects all Ontarians. It's something that we always want to fight for. And speaking of fighting, I have been trying to get the attention of the past Liberal government and, of course, now this government. I've walked over several letters to the Minister of Health. St. Mary's Cardiac Centre in Kitchener-Waterloo, it serves multiple ridings: Wellington, Halton Hills, Oxford, Huron-Bruce, Bruce Grey, Owen Sound, Haldimand, Norfolk, Brantford, Brant, Kitchener, South Hespeler, Kitchener, Conestoga, Cambridge, Perth, Wellington, and Guelph. And they have been asking just for the permission to follow through on an electrophysiology program, an EP program at St. Mary's Hospital, and a catheterization suite. And so I just want to, this is essentially like a love letter to the Minister of Health, if you will, and I say, Minister Elliott, we are writing to you to share our support of a third catheterization suite in the electrophysiology program EP at St. Mary's Hospital in Kitchener. St. Mary's is the second largest acute care hospital in the St. Joseph's Health System and one of Canada's top 3 regional cardiac care centres. In 2018, a report by the Canadian Institute for Health Information, St. Mary's dedicated team performed better than the national average across all 6 indicators, with the lowest readmission and mortality rates for angioplasty, cardiac bypass, and valve replacement surgery. Nearly 2,000 staff, physicians, and volunteers provide cardiac care to the residents of Waterloo Region, Wellington County, Dufferin, Grey Bruce, and beyond. Due to the population growth and a variety of other factors, cardiac care needs are expected to substantially grow within the next 5 years. The team at St. Mary's is striving to meet the growing demands of the large area of 1 million residents that they serve who require cardiac catheterization and angioplasty. They cannot do so without a third catheterization suite to support volume growth and decrease wait times. Most cardiac centres performing the volume of procedures that St. Mary's performs have 3 or 4 catheterization suites. St. Mary's has also been working to increase access to electrophysiology for cardiac patients in our community. Currently, patients have no option but to travel to London, where they face an 8 to 10-month wait for this necessary procedure. St. Mary's began discussing the need for their own electrophysiology program with the Ministry of Health and Long-Term Care in 2012 and have since raised $15 million to establish a heart rhythm program to include EP. They are awaiting final approval by your ministry so that they can proceed to tender. They just need the approval. Mr. Speaker. St. Mary's is ready to lead and is prepared to address the gap in service in southwestern Ontario. It is our hope that all MPPs in the catchment area can work together to secure provincial funding to support the growth and the expansion of cardiac care at St. Mary's. We would be pleased to schedule a meeting with all of the regional MPPs, hospital representatives, and yourself to discuss this further. And I'm very pleased to get that on the record and on Hansard because they have waited so long. These labs actually will provide a preventative component to healthcare, and we all know that those upstream investments save money down the line in healthcare. They're smart.